One of the challenges in healthcare today is documentation, right? So how we capture our interaction with you as a patient and put it into the medical records that we have a log of what happened, right? Doing that with an electronic medical record means a lot of us spend time in the system while we're talking with our patients, and that takes away from our attention, our time with our patients. Abridge is a great way to get around that and allow something else to do some of that work for us so that we're just doing more editing than we are doing all the actual data entry piece of it.
Yeah, I mean, you're sitting here looking at me like you would, but you've got this computer on your side. I would prefer you talking to me as opposed to talking or typing in the computer. We recently saw one of your colleagues, Dr. Denton Shanks, in clinic using Abridge, and we saw him basically press record on his phone right as he entered into the clinic visit. But outside of that, it didn't look or feel much different from a normal clinic visit. So for a patient, what difference is there going to be?
Hopefully there's a big difference in the attention your physician pays to you, right? I think one of the biggest things I've noticed since using this tool over the last year is that I spend most of my visit face-to-face with my patients, which is fantastic. And very little time in the EMR, all the time demonstrating or showing them something that's a test result or an image or something like that.
A few minutes ago, we started a little demonstration where I was describing some actual jaw pain that I felt in the past, just like I would if I was sitting down in a first clinic visit with you. And Abridge was listening the whole time. Let's go ahead and see what Abridge heard and how it gets entered into the chart. So what did it see?
Right. So first it pulls in our conversation. You can see right jaw pain, tip and joint symptoms. It bullets or highlights the symptoms that you had that went along with that. And just as an example for our conversation, you said it was 1 or 2 weeks long, particularly with palpation. It's significant enough to cause wincing, especially when you're accelerating or stopping your car, right? So it captured a lot of the key episodes. It also talks about your history, right? The deal that you grind your teeth at night, you have a mouth mold, but maybe don't wear it as often as you should, right? So it captured all of that symptom, and including the negatives, where you don't have any issues really with your ears, other than some ringing in the ears, but that's not really directly tied to this.
I see a brief outline kind of what I talked about, some bullet points there, a paragraph under the assessment and plan. How does that compare to what you would be able to write?
So the more I've used it and the more I correct things or change things, the more it becomes like what I would like to use from my notes. Ultimately, I still have to go through and edit this much like I would if it were a transcriptionist or a scribe in the room or something like that. The documentation is still mine. I have to validate what was recorded and put in there, but ultimately it's very close to what I would need, and so I don't need to spend a ton of time editing and reviewing it, which is really nice.
Doc, thank you so much for letting us into your clinic today.
My pleasure.